Hello, my name is Dr. Ominde, and I'd like to complete the lecture series on the nose and the paranasal sinuses. So we're discussing the paranasal sinuses. We continue with from the ethmoid sinuses. So we have three group of air cells in the ethmoid sinus: the anterior, middle, and posterior ethmoid sinuses. These are housed within the ethmoid bone. The ethmoid bone is located between the nose and the orbit. Now, the ethmoid sinuses are separated from the orbit by a thin plate of bone. Okay, and this is very important for you to know. A thin plate of bone separates the ethmoid sinus from the orbit. Therefore, if you have infection in the sinus, like sinusitis, it can spread to the orbit because this bone that delineates the two is very thin. The ethmoid sinuses are innervated by an ciliary nerve, which comes from ophthalmic division of trigeminal. So this just shows you the presence of ethmoid bulla here, and anterior ethmoidal air sinus opens through the middle meatus, while the posterior ethmoid sinus opens through the superior meatus, which is below the superior concha. So the anterior ethmoidal cells, they drain into the middle nasal meatus through the ethmoidal infundibulum. The middle ethmoidal cells are also called the ethmoidal bulla, and they drain into the middle meatus, while the posterior ethmoidal cells, they drain through the superior meatus. So anterior and middle ethmoidal cells drain into middle nasal meatus, while posterior ethmoidal cells drain into the superior meatus. So what are the clinical aspects of the nose and the paranasal sinuses? So in this CT scan, you can appreciate that this nasal septum has deviated. In most cases, it's midline, but this has deviated from the midline. So this deviation, it could be a normal variation, but it can also be caused by injuries during birth or trauma. And when there's this deviation of the nasal septum, if it's extreme, it can obstruct the airway, obstruct breathing, and worsen snoring. And the deviation also can affect or block the structures on the lateral nasal wall, like the meatus on the lateral nasal wall, leading to impaired mucociliary drainage and impaired ventilation of the paranasal sinuses. So this is the maxillary sinus here. These are the concha. This is inferior concha, the middle concha, and the superior concha. This is what we call the ethmoid infundibulum here, and this region is what is referred to as the hiatus semilunaris. So this is the middle meatus. So the maxillary sinus drains through the ethmoid infundibulum before you get to the hiatus semilunaris and enter through the middle meatus into the nasal cavity. Ethmoid infundibulum, hiatus semilunaris, then the middle meatus, and enters into the nasal cavity. So you can have infection spreading. So if the drainage of these paranasal sinuses, or rather the drainage of the nose, if there is obstruction, okay, you'll have infection of the ethmoid cells, and this can break the wall of the orbit. Remember, the ethmoid cells are separated from the orbit by a very thin wall. So if you spread infection from ethmoidal air sinuses due to obstruction in the nose, this infection can get to the orbit and it may lead to blindness. Why? Because posterior ethmoidal cells are close to the optic canal, and optic canal houses optic nerve, which is responsible for vision, as well as ophthalmic artery that supplies the orbital structures. Infection could also affect dural nerve sheath. Remember, optic nerves. So if you have infection from ethmoidal cells, optic canal affecting the optic nerve and the dural nerve sheath around it, you tend to get inflammation of the optic nerve, which you call optic neuritis. Remember, the floor of the maxillary sinus is formed by the alveolar processes of the maxilla, and there is a communication. For example, during removal of teeth, if you accidentally fracture the alveolar process of the maxilla, you can spread infection from the teeth into the maxillary sinus. Okay, and remember, you have lots of bacteria in the oral cavity, and this can spread into the maxillary sinus. Remember, maxillary sinus is supplied by superior alveolar nerve, and these nerves also supply the maxillary teeth and the mucous membrane of the maxillary sinus. So when you have toothache or a decayed maxillary tooth, you tend to sort of have pain that radiates towards the maxillary sinus because of shared innervation. Then you have inflammation of the maxillary sinus mucosa, can be accompanied by toothache of the maxillary molar teeth. So this just shows maxillary sinus that has pus, and this is how the drainage is carried out. And you can see the alveolar processes of maxillary teeth form the floor of the maxillary sinus. So when you want to drain pus, that's how they access, by Cladwell-Lux operation. This, when they're doing, again, the site of incision for maxillary sinus, pus, and this is how they access it to drain. Thank you very much.